Dorothea Dix was an educator and social reformer whose devotion to the welfare of the mentally ill led to widespread international reforms. Dix's reforms focused primarily on the betterment of the mental health institutions, improvement of living conditions of the mentally ill, and restoring dignity to those who suffered with mental illness. Dix's contributions greatly influenced the de-institutionalization movement and proved to be a massive impact on the antebellum reform movements and subsequent progressive era reform movements. Dix began teaching at the East Cambridge Women's Prison. In the 1840s, it wasn't just criminals who were sent to prison. Most of the inhabitants were mentally ill or deemed insane. Dix immediately noticed the appalling conditions and inhumane treatment of the inmates and began advocating for the humane treatment. Prisons during this time period were unhealthy, unsafe, unregulated, unsanitary, and overcrowded. Because of this, all prisoners were housed together. This includes children, mentally ill, serious criminals, and petty criminals, all housed side by side. Dix was able to document all of her findings and present them to the legislature of Massachusetts. Her report showed numerous accounts of sexual abuse, physical abuse, and neglect. Dix's findings shocked the community and galvanized a movement to improve conditions of the imprisoned and mentally ill. Over a 40-year period, Dix was able to persuade the U.S. government to fund the building of 32 state psychiatric hospitals, the funding that would allow separation of serious criminals and the mentally ill. In the 1900s, Clifford Beers wrote an autobiographical book titled A Mind That Found Itself, published in 1908. In his book, he recalls witnessing and experiencing maltreatment by staff while he was institutionalized at private and state facilities. Beers' book helped create further awareness about the conditions and treatment of those in institutions. In 1909, Beers founded Mental Health America, an organization which works to improve the lives of the mentally ill in the U.S. through research and lobbying efforts. In 1946, Harry Truman passed the National Mental Health Act, which created the National Institute of Mental Health and allocated government funds towards research into the causes and treatments for mental illness. Around the 1950s, the push for de-institutionalization and the need for outpatient treatment began, facilitated by the development of psychiatric medications like lithium and Thorazine. De-institutionalization gave many more individuals with mental illness the opportunity to live in their communities rather than be confined to an institution. Medication and therapy were said to be key factors to treatment, but little thought was given to how these individuals' daily functioning and social interaction would be impacted. Medication and therapeutic interventions allowed individuals to successfully leave facilities, but did not help properly prepare for community living and social interaction. This is where psychosocial rehabilitation gained prominence. PSR programs were developed to address these issues and generally focus on 5 areas: psychiatric and physical health care, symptoms and self-management, socialization skills, practices through family and community relationships, pre-vocational and educational skills, basic living skills, personal care, and financial skills. On October 31, 1963, President John F. Kennedy signed into law the Community Health Act, which drastically altered the delivery of mental health services and inspired a new era of mental health care. The Community Mental Health Act led to mental health centers throughout the country, which in turn helped transition individuals who reside in hospitals and institutions back into their communities. With the passing of this law, the development for more effective psychotropic medications and new approaches to psychotherapy made community-based care for the mentally ill a more realistic solution. Over time, it was proven that with proper care, mental illness could be treated within the community setting, and this was also more cost-effective than psychiatric institutions. Community-based healthcare continued to become more effective, offer access to quality healthcare, and evolved far beyond the original blueprint that was previously created. In 1979, the National Alliance for the Mentally Ill was founded, which provides support, education, advocacy, and research services for mental illness. The self-help movement began with the establishment of AA, founded by William Griffith Wilson in 1935. The successes of AA were impressive in terms of treating alcoholics and exceeded those made by medical professionals. Throughout the 1990s, self-help became an alternate avenue for support, offering online and group setting options for support, and with this came peer counseling. The civil rights movement of the 1960s was a time where people band together and discussed and advocated for current issues such as government spending and inefficiency. This was how people discovered the power of group efforts. Self-help has become a valuable tool to those who've used it. It has offered information, education, support, and how to cope with specific problems or situations by offering different perspectives. Additionally, self-help groups offer social advocacy. Mental health frequently utilizes group support for individuals suffering from issues such as mood disorders, anxiety, and compulsive disorders. Support groups are not only used by single individuals, but sometimes for families who struggle with these issues as well. Rehabilitation services were introduced as a federal program following World War I. The emphasis for these first rehabilitation programs were on veterans with disabilities who were returning home to the United States. The need for training or retraining created the first federally funded program for people with disabilities, a program now known as the Federal State Vocational Rehabilitation System. Not until the social change movements during the 1960s were other major services for people with disabilities seriously considered by federal legislation. Although the Social Security system provided benefits to those who had earned sufficient income over a long enough period of time and who had become disabled through work, there were no attempts to broaden the base of services for people with disabilities beyond vocational rehabilitation approaches. For the first time in U.S. history, consumers, advocates, and service professionals began an intensive examination of the human service delivery system to decide what was missing. Community-based programs for people with disabilities began growing all over the nation in an attempt to fill the gaps left by missing services. New concepts, technology, and new attitudes were beginning to make a difference in the lives of people with disabilities. 5 other social movements of the 1960s and 70s contributed to the evolving movement for independent living for people with disabilities. These were civil rights movement, consumerism, self-help, demedicalization, and de-institutionalization. These 5 movements created the atmosphere necessary for the disability rights movement and led to the development of centers for independent living. The independent living and disability rights movement that grew out of the late 60s was unique in 2 critical ways. First, people with disabilities were in charge of their own advocacy and organization. People with disabilities moved away from charity-based models that dominated many existing disability organizations. Secondly, people with various types of disabilities began to join together in their efforts for advocacy. It became apparent that their old system of single disability organizations had separated. The independent living and disability rights movement that grew out of the late 60s was unique in 2 critical ways. First, people with disabilities were in charge of their own advocacy and organization. People with disabilities moved away from charity-based models that dominated many existing disability organizations. Secondly, people with various types of disabilities began to band together in advocacy for their efforts. It became apparent that the old system of single disability organizations had separated those with The independent living and disability rights movement that grew out of the late 1960s was unique in 2 critical ways. First, people with disabilities were in charge of their own advocacy organization. People with disabilities moved away from charity-based models that dominated the existing disability organizations. And second, people with various types of disabilities began to join together in their advocacy efforts. It became apparent that the old system of single disability organizations had separated those with disabilities. The independent living and disability rights movement that grew out of the late 1960s was unique in 2 critical ways. First, people with disabilities were in charge of their own advocacy organization. People with disabilities moved away from charity-based model that dominated the existing disability organizations. Second, people with various types of disabilities began to join together in advocacy for their efforts. It became apparent that their old system of single disability organizations had separated people with disabilities. In 1972, the first independent living center was opened by a group of students led by Ed Roberts at the University of Berkeley. It was these same students who created a new model for self-help and peer support for individuals with disabilities. Shortly after, at least 5 other states had developed centers of independent living based on the Berkeley model. In 1973, the Rehabilitation Act was passed. For the first time, the U.S. federal government guaranteed certain rights to individuals with disabilities. In 1979, Vermont opened its own independent living center. It successfully advocated for state legislation and funding for a program that is now known as the Attendant Services Program. Since most traditional rehab programs were built on the medical model of service delivery, the disability rights and independent living movement promotes a completely different approach to service delivery. Independent living as a movement is quite unique compared to existing programs and facilities serving people with disabilities. Centers for independent living across the nation are working towards changing their communities rather than fixing the individual with a disability. Centers for independent living were originally defined by the first Berkeley model and are now commonly referred to as consumer-controlled, community-based, non-residential, not-for-profit organizations providing both individualized services and system advocacy. In 1990, the Americans with Disabilities Act is passed. This is a civil rights law that was passed that prohibits discrimination against individuals with disabilities in all areas of public life. This includes employment, schools, transportation, and any and all public or private locations that are open to the general public. The ADA also extended to the telecommunications industry. Telephone and internet companies were required to provide relay services nationwide to individuals with hearing and speech disabilities and to close caption any public service announcements. In 2008, the Mental Health Parity and Addiction Equity Act became a law. This changed the policy on substance abuse treatment because it redistributed the bulk cost of substance abuse treatment from the federal government to group health plans. The law required that employee and public insurances that covered health or surgical care also provide comparable terms of coverage and treatment limitations for substance abuse. The Affordable Care Act, or Obamacare as it has been dubbed, is a healthcare reform law that was passed in 2010 and signed into effect by President Barack Obama. The act was meant to create affordable healthcare for everyone, meaning individuals could not be turned down for pre-existing illnesses. In short, this act targeted what many people saw as problems in our healthcare system, such as quality of care, access to care, assistance of services, and medications. House Representatives Tim Murphy and Edie Johnson introduced the Helping Families in Mental Health Crisis Act of 2015. This bill was passed on July 6 of 2016. Senators Lamar Alexander and Patty Murray introduced the Mental Health Reform Act of 2016 with support from Bill Cassidy and Chris Murphy. The bill was passed in December of 2016. Both of these bills were proposed to improve integration and program coordination across federal stages and serve individuals with mental illness, improve integration of mental and physical care, and promote early intervention and treatment of illnesses, and use evidence-based interventions and provide resources for suicide prevention.